Hi, I'm Dr. Todd House, a Bodylogic MD physician in Hawaii. I practice with Dr. Jeff Maihara at Bodylogic MD Honolulu. We service all of the Hawaiian Islands, however, and we practice holistic integrative age management medicine. I like the science in anti-aging medicine a lot. The science is cutting edge. This science, this type of medical practice is capable of dealing with the patient as a person in a real holistic view. A high percentage of our patients approach us from the endocrine point of view, hormones, and so that tends to be what people associate with the kind of medicine that we do, is that we're hormone doctors, if you will, but it's far more than that. Nothing that we do stands alone by itself. Nutrition, mind, body, meditation, prayer, those are key components as well. Exercise is essential. We're going to take at least a 6 month to a year view before we decide whether this helped or not. Because it takes that long to restore nutrient levels with nutrition and exercise, and to control stress with some mind-body work. And those things have to be learned, and especially mind-body, meditation type things. And the nutrition and exercise, which we all know about, those don't necessarily have to be learned, but they have to be incorporated. And we want to do things more gradually than abruptly, because we know that people will maintain a lifestyle, a new approach to lifestyle, if they gradually make changes that they can live with over time. So I emphasize nutrition, and we evaluate a whole range of laboratory studies and physiologic studies to tell us about nutrition status. We even apply a little bit of genetics testing. There are genetic studies that can show people their tendencies, and just knowing how you're wired sometimes will help you make better nutrition and exercise decisions, ones that you can really commit to, because you know that that is the way I'm programmed, that's the way I'm wired, I must do it this way. The other way won't work. And so those things take a little bit of time, but they're so essential to this overall process. It's easy to measure hormones and throw hormones at people. That's really simple. But when you integrate it all and you take the holistic view and apply things over time carefully with lots of feedback and monitoring of progress and blood studies, then we have really positive results that will last for the long term.
I had a hysterectomy when I was 30. And from that, I was on medication Premarin for over 20 years. And so I was having hormonal issues. Last September, I went into adrenal fatigue. The big thing though is I've had chronic pain, bone and joint muscle pain for 20 years. 24/7, I was not sleeping well. And that was the biggest thing, is I couldn't take the pain anymore. I knew I was having problems with the hormones, but the pain was more my issue. So I found Bodylogic online and gave him a call. So we made an appointment. I ran some tests. My body was so racked with inflammation. Every test that he ran, we did the Nutri-Eval test, and he ran another one. It all came back the highest inflammation on every test. That was throughout my body. And he told me I need to go gluten-free. And I was like, okay. And within a week, I knew there was a difference. And right now, about a year later, I'm 90% pain-free. I've lost 35 pounds, healthier than I've ever been in my life. He's been really monitoring the bioidentical hormones and the vitamins that he's given me, the probiotics and the other vitamins. He's helping me for my food to be processed correctly. So that's what I like about Bodylogic. It's not just one thing. He's taking the whole picture. He's looking at your physical, your nutrition, your chemical. That's what I liked, is the whole picture is being looked at.
If you'd like to know more about our practice, you can go to bodylogicmd.com, search the site for the state of Hawaii, and you'll find our practice.